All right, we are at the hour, so I will get started. Thank you for joining us for today's webinar, Center for Learning, a free resource for staff development in mental health and addictions. My name is Marla Kaufman, and I'm the Communication and Health Promotion Associate at IRETA. I'll be moderating our webinar today. I would like to go over some quick housekeeping items about how to use the WebEx technology and how to access continuing education credits. First, we would like to encourage you all to participate in today's webinar in a few ways. If you have questions for our presenter or are experiencing any technical issues, please use either the chat function or the Q&A panel to communicate your questions. Our presenters will take questions at the end of the webinar. Feel free to submit your questions through the chat or Q&A box at any time. This webinar is approved for 1.5 PCB and/or NADAC credits, which are free. A certificate of attendance will also be available to download from your MyIRETA account within 48 hours of the webinar. Please take note, again, it will take up to 48 hours for your CEUs and certificate to be available in your MyIRETA profile because we have to cross-check your attendance with WebEx following the webinar. After the webinar, you will receive a follow-up email. The first will be an email that will include a link to an evaluation form for the webinar, as well as more information on how to access your certificate of attendance and continuing education credits. We may send you an additional email to remind you of the evaluation. I would now like to introduce today's presenters. Rick Johal is the Senior Lead for Provincial Education at BC Mental Health and Substance Use Services, providing project management for various concurrent disorders, workforce capacity initiatives. Additionally, he leads the psychotherapeutic education rollout within correctional health services, forensic psychiatric services, and correctional health services. Rick's background also includes being a registered social worker. Dr. Heather Fulton is a registered psychologist who provides training, supervision, and consultation to helping professionals and organizations regarding evidence-based practices in mental and substance use health, including trauma-informed approaches. She is an adjunct professor in the Department of Clinical Psychology and a clinical instructor in the Department of Psychiatry at the University of British Columbia. Karthik Sathya Morthy is a project manager for the Center of Learning within BC Mental Health and Substance Use Services. He is an internationally trained dentist and public health professional who has been working in the health innovation space, providing project program management support to evolving health organizations. I'm going to quickly launch some poll questions here for everyone joining. And then as people answer the poll questions, I will hand things over to our presenters. All right, just a few seconds left for that poll if you haven't answered yet. And we will launch those results now. Are you able to see those results? Nope. All right, let's see. How about now? All right, perfect. All right, Rick, I'll hand things over to you.
Great, thank you so much. Can everyone hear me all right? So thanks, Marla, for that wonderful introduction. Again, my name is Rick. And today we're going to be talking a little bit about our free resource for staff development. So who are we? So again,
My sound
Marla,
just cut out for Rick. Is that just me?
Sorry, Heather?
Your sound cut out a little bit. You got a lot quieter.
Okay, sorry about that. How's that?
That's better.
Thank you so much. So again, who are we? I'm Rick Johal, the Senior Lead for Provincial Education. As Marla mentioned it as well, Heather is a consultant and a registered psychologist, and Karthik is our project manager for Center for Learning. We're here to talk a little bit about our Center for Learning website. So Karthik, can you go to slide 3, please? So much. So the Center for Learning, what we'll call the CFL, is an accessible learning platform.
Rick, it seems like something is going on with your sound. You cut out again. We can't hear you now.
How was that? How was that?
That's better.
Is it?
Yeah.
Okay. You can hear me all right?
Yes.
Okay, thanks so much. Sorry about that, folks. So again, the Center for Learning, our CFL, allows professionals not only to assess competencies, but also provides a customized learning plans for service providers at any level of experience in mental health and substance use care. The BC Mental Health and Substance Use Services, the organization that we all work for, offers public health care to residents throughout British Columbia and Canada. Their services include adult mental health and substance use services, forensic psychiatric services, and correctional health services in BC. BC Mental Health and Substance Use Services is actively involved in several provincial workforce capacity initiatives focusing on enhancing worker competencies in mental health and substance use care. BCMHSUS is part of Provincial Health Services Authority, which is one of our major government publicly funded health service providers in the province of BC. For our American and other international counterparts, a province in Canada is a lot like a state in the US. British Columbia is located on the west coast of Canada and includes cities such as Vancouver and Victoria, as well as island and northern communities just north of Washington State. So some disclosures before we begin. We all work for PHSA, a nonprofit government health organization located in British Columbia, Canada. We also receive no profits or monetary gain related to people's use of this website. It's entirely free. So here's our learning objectives, which were circulated prior to this session. Essentially, what we want to share with you is a new free resources that help you and your staff learn about mental health and substance use care. We have worked hard to include people with lived and living experience in the development and strategic planning, as well as incorporate the latest scientific evidence. These tools are very user-friendly, although we're open to ongoing feedback and development if you disagree. We just want to get these out and used by as many people and as many organizations as possible. So we're hoping today you leave with the ability to describe our online, interactive, and freely available Center for Learning, including where to access it and how it can be used to support ongoing professional development in mental health and substance use care. We want you to be able to apply the competency framework to assess and review your own professional competencies within mental health and substance use services. And finally, we're hoping that you can identify and outline the various resources available within the Center for Learning that can enhance individual competencies and facilitate a progressive learning journey in the field of mental health and substance use. So what is the CFL? Our CFL is an innovative web platform for hosting and curating learning resources and projects aimed at developing workforce capacity for people who support people with mental health and substance use needs. We've got lots of resources on this website, but today we're only going to be talking about 3. Each stand out on their own, but we suggest that they work best actually as an individualized learning pathway. What we think sets our free learning resource apart from others is that people can start their learning journey by first completing an assessment of their own competencies that are important for people working with people who have mental health and substance use needs. There's also an interactive learning curriculum that is posted with more modules being added for enhancing competencies and working with people with concurrent disorders. And we also have a resource library that you can self-direct your learning based on your learning plan from the competency framework to achieve your unique learning goals. So in summary, the CFL is a platform where you can direct your own learning that is tailored to your individual strengths, your existing competencies, and your unique settings and roles. So now I'd like to show you the website, how to navigate it, and how to go through each of the resources. But just before I get started, I should mention some terminology. So we are going to be using the word concurrent disorders. In Canada, this is the main term we use to describe the situation where someone has a substance use disorder as well as a mental health diagnosis. I know in the US, the term dual diagnosis tends to be more common. In Canada, the term dual diagnosis typically refers to someone who has a co-occurring mental health diagnosis in addition to an intellectual or developmental disability. So this is why you're going to see the term concurrent disorder throughout our presentation. So I'll tell you first about the first of the three resources that we're going to cover today, which is the Competency Framework and Toolkit, the resource which we launched in 2022. The Competency Framework is an online interactive competency self-assessment that allows people to assess themselves against 16 different concurrent disorders competencies. It also includes a resource catalog of evidence-based concurrent disorders learning resources. What's different about our competency framework? Well, the challenge with many competency-based assessments that are out there is that they're normally based on performance appraisals that are done rarely and include a lot of subjective interpretation of terms, including foundational, intermediate, and advanced. So for example, if I'm a supervisor working with staff and I need to determine what those terms mean and rate it, that interpretation may vary depending on the individuals looking at it. So each assessment often looks very different. The other piece about a framework is that it's often taken of a snapshot of a person at a given point in time. They normally don't include any career guidance. So perhaps you may want to increase your competency framework to achieve a specific role or desired career position. Or maybe you want to move from a nurse to a clinical leader. You know, in our assessment, you can change the competency levels and the framework adjusts around your career goals as well. So if you want to pick a particular job in the future, the competency assessment will change and evaluate based on that career goal that you have. So it really helps us extend the life of the framework as an ongoing personalized development to improve over time. So I'm going to show you what this looks like in practice in a moment. But first, you might be wondering, why our competencies? What makes our competencies the competencies you should rate yourself against? How did we develop these competencies? Well, in 2018, our organization commissioned an environmental scan into the assessment and screening and treatment of individuals with concurrent disorders. We did a rigorous literature review. We interviewed clinicians. We looked at a variety of Canadian international best practices. And out of that report, we developed 48 competencies. We took those competencies and we rigorously refined them in a way that allowed us to extend the life of those competencies. And we launched our first concurrent disorders competency framework and toolkit within our organization. That was really successful and we had a lot of great feedback. And we really started to standardize the way in which our organization approached individuals with concurrent disorders. In 2022, we received surplus funding from the government to bring the concurrent disorders toolkit outside of our organization, bring it to the modern age and offer it to the provincial audience. So on the heels of our internal success, we were able to do that. And through that, we were able to update it and develop additional resources to support increasing competency, which includes the concurrent disorders curriculum, which we'll be talking about today. So let's go through the competency framework itself. So if you'd like to take a look at the Center for Learning, we've got the QR code here. It is available on mobile devices. You may not be able to follow along because you'll need to register first. The registration is free. It takes a couple minutes, but if you want to take a look at the website while we go through the demo, you can do that as well. So Karthik, I'm going to share the Center for Learning. Okay. So I'd like you to show you what this looks like in practice. So when you arrive to the Center for Learning, in order to access our services, you're going to want to register. So the website itself is a curated list of all of our provincial workforce and capacity initiatives. Today, we're going to only talk about a few. So in order to access the competency framework first, what you're going to do is create a free account with us. It takes a couple minutes. It's completely free. And once you do, you're brought to these dashboard. So the dashboard represents the individualized learning space. This is where you get to personalize your learning.
Sorry, Rick, can I
really...
just slow you down one sec? Where did you
Sure.
click to create an account? Because on the web page, it might not be totally clear to people. Where did you click to create an account?
In order to access the toolkit and the dashboard, what you do is click on the login button, which will allow you to create a free account. Here. Can you folks see my mouse, by the way? Yeah. And once you've logged in, once you've created an account, during the registration, you'll be choosing your occupational group, which customizes the learning space around you and customizes the competency framework. So to access the competency framework and toolkit, you're going to go on the left-hand side here, click on CD Toolkit, and click on Competency Framework. So this is where you find the Competency Framework Toolkit. So learners assess themselves against 16 competencies within 4 domains. Those domains include understanding concurrent disorders, partnerships in care, recovery-oriented care pathways, and safe transitions. The unique thing about the competency framework is how we deliver content to individuals. In creating the competency framework, we're not only aiming to provide competencies, but an innovative way of presenting information to learners. As I mentioned earlier, existing frameworks traditionally live within performance appraisals or within documents that are rarely accessed. Metrics within these frameworks often include subjective appraisals that skew the results. With the CD framework, we want people to have a clear understanding of how to assess themselves and give reasons to continuously return and assess their competencies. So let's take a look at the competency framework itself. Once you've created your account and picked your occupational group, you're navigated to the framework dashboard. My self-assessment right at the top here provides an at-a-glance progress tracker in your journey in increasing your competence in concurrent disorders care. The domains bar allows me to navigate between all the different competency categories that we've created here. Each competency is listed here with definitions of each competency. This is to help reduce the ambiguity in what the different terms mean for each of the competencies. Your current level gives your assessed level that we'll be looking at in a second. And my recommended level is the recommended level based on your occupational group that you choose at registration, which you can change anytime. So let's take a look at the self-assessment and see what this actually looks like. So the self-assessment, what we've done is we've worked really hard to really reduce ambiguity in the way in which folks assess themselves. The competency under concurrent disorders, understanding concurrent disorders is listed here, the first competency, which is concurrent mental health and substance use conditions. We've got a definition of the competency itself. And then what we've done is created behavioral competencies that allow individuals to really cut out the ambiguity when assessing themselves. So let's do one of the assessments right now. So for concurrent mental health and substance use conditions, we define that as background or contextual knowledge of concurrent disorders, including common mental health and substance use disorders that occur, as defined by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, and understanding that presentation, treatment, approach, and path to recovery are individual and vary greatly, depending on the types of mental health and substance use disorders diagnosed, their severity, and how each impact each other. Now, normally, traditional competency frameworks will stop there and encourage people to assess themselves on these 4 levels based on that limited information. So what we've done is we've explained that a little bit further. So each competency has the option of saying, I don't understand, and I'm not at that current level, which we define as working towards foundational knowledge and skills in this competency. The foundational examples include explains what is meant by concurrent disorders and the importance of integrated approach to treating mental health and substance use conditions, and describes the relationship between mental health and substance use and the prevalence of concurrent disorders. Our intermediate examples include describes common mental health and substance use disorders that co-occur, including signs and symptoms, the complexities in presentation and treatment trajectories, and understands the difference between coordinated care and integrated care and applies integrated team-based approaches in practice. And finally, our advanced examples include supervises or mentors other professionals working with people with concurrent disorders and leads the development and implementation of seamless, evidence-informed approaches to the integrated delivery of services and care for people with concurrent disorders. So these tailored examples are specific to this competency, and we've done that for each of the competencies within the competency framework. A foundational level essentially is a theoretical understanding of a competency. The intermediate examples will be a practice-based example, and in advanced examples will be more of a leadership-based examples to allow people to kind of identify where they're at. So let's pick the one where I think I'm at, which would be intermediate. So our next competency is the impact of stigma on individuals with concurrent disorders, which is defined as the background knowledge of various types of stigma, how stigma impacts individuals' ability to access services, and how professionals can implement destigmatizing approaches in their practice. Our foundational examples include collaborates with people to understand the impact of stigma and identifies evidence-informed strategies to address different levels of stigma, including self, social, organizational, and structural stigma. And as well, it utilizes compassion, inclusion, and engagement strategies to reduce the effects of stigma. Our intermediate example is understand the impact and relationship between intersectional factors and multiple layers of stigma, for example, culture, gender identity, sexual orientation, race, etc., on people with concurrent disorders and employs destigmatizing approaches and strategies in practice. And finally, our intermediate example advocates and contributes to the policies and practices that address stigma in care settings and develops and promotes anti-stigma initiatives includes key stakeholders, including family members, caregivers, partners, and social supports in the design, delivery, and evaluation of these initiatives. So I'll choose my competency level here. And then finally, the impacts of determinants of health on individuals with concurrent disorders, which we define as knowledge of the role that various social determinants of health can have in the development of concurrent disorders, one's ability to seek or access care, and the impact on treatment outcomes. The social determinants of health are defined by the World Health Organization as the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Determinants of health include the social, economic, structural, and environmental factors that have a major impact on people's health and well-being. And some examples include education, income, food security, housing, early childhood development, and systemic racism. So our foundational examples for this competency include explains how various determinants of health impact individuals with concurrent disorders, their families, and communities, and lists the risks, protective and resiliency factors for people living with concurrent disorders and how these factors may impact access to appropriate services, engagement in care, and successful care outcomes. Our intermediate examples include collaborates with people to identify personal and systemic factors that shape an individual's understanding of their diagnosis, and collaborates with other agencies and service providers to address challenges like employment, housing, and other determinants of health that intersect with concurrent mental health and substance use conditions. And finally, our intermediate examples include incorporates relevant research findings and knowledge of determinants of health and risk protective factors in program planning, implementation, and evaluation, facilitates and contributes to collaborations with senior stakeholders and other organizations to advocate for system-level changes to address determinants of health. And finally, engages in critical analysis of current public policy and understands its impact on individuals. So I will choose my example here. Once I've completed the self-assessment, the competency framework reflects that under your current level. So what you can see from my current level here is that I've reached my competency in these first two competencies indicated here. However, the impact of determinants of health on individuals with concurrent disorders is still at a foundational level. Once I complete one of the domains, I'm encouraged to complete the rest of them so that I can get a snapshot of exactly where my competencies are and my practice is as it relates to working with people with concurrent disorders. Once I've had a fulsome understanding of kind of where I'm at and the things that I know and don't know about my competence, I'm then encouraged to explore the learning pathways. So the learning pathways are our customized learning, curated list of learning resources that really allow me to address some of the gaps that I've noticed in the competency framework. In order to find the learning pathways, you can click on the side panel again, go to CD Toolkit and click on Learning Pathways. Our learning pathways, again, are a curated list of learning resources from across the internet. All of these resources are evidence-informed. We've done a rigorous review of these resources, and we're adding more every day. You can organize the learning resource library around the different domains. Say, for example, my gap was in understanding concurrent disorders, and I realized that I needed to do more intermediate level training in that competency domain. I can filter that. I can search by tag as well, apply that filter. And then the resource library is organized around that specific competency and that specific level that I might have a gap in. I can take any of these resources and I can add an action associated with them. So say, for example, mental health and substance use glossary, I can open that up. And I can add that to a plan. So I can click a self-directed due date, then submit that there. And once I've completed that, that learning plan has been added to my dashboard. So if I return to my dashboard, I can see that my learning is reflected here as well. So the learning planner that we have here allows us to save any tiles and add actions associated with those learning resources from any of the projects on the website, including the competency framework and toolkit. In addition to the competency framework resource library that we have here, we also have a general resource library, which you can find by clicking on Find Courses and Resources and Explore Resource Finder. This larger library includes all of the resources that we have within the competency framework and toolkit, as well as all of our different projects within BC Mental Health and Substance Use Services aimed at developing workforce capacity. Each of the projects have their own resource here, and you don't have to leave our website to view some of these resources, even if they exist somewhere else in the internet. So that's a competency framework and toolkit, as well as our resource library. I'm going to stop sharing now.
Oh, Rick, would you like to talk about favoriting resources?
Sure, yeah. So one of the great features that we have with the competency framework and toolkit learning resource library, as well as the general resource library, is that sometimes folks may not want to add an action associated with the learning resources. They just want to remember it. And so we have the ability to add favorites here, which doesn't necessarily add a task associated with a resource, but does allow us to track those resources so that we can save them at a later date. It's just a really unique way of creating playlists of information. You can create that playlist, you can go back to it, but you can also add an action associated with that. And the great thing about adding an action is that you can add your own self-directed due date. All of the things in the plan integrate with Apple, Google, and Outlook calendars as well. And all my completed learning is tracked within the website as well. And I can write reflections on those learning as well, which is really helpful for a lot of folks. I know for me, when I have to do my college requirements every year, this is a great way for me to track all my learning in one place. Thanks, Heather. Sorry, I forgot that. Perfect. Do you mind putting the slide deck back up? So we've launched this within our province so far. We've got over 1,000 people registered, and the feedback is great. We've got a lot of people that are really enjoying using the competency framework and toolkit, being able to assess their competencies, and it's really launching off. One of the things that we noticed though was that before we go to that slide, Karthik, one of the things that we noticed though was that there was a gap of existing learning resources out there directly targeting concurrent disorders. And so one of the things that we realized was that we need to provide additional learning resources. We can't just curate a list of resources that exist out there. We need to create learning resources that specifically address the competencies within the competency framework. Heather's going to be going into that in a minute, but I want to pause here and just see if anybody has any questions about the competency framework itself, the toolkit. I know a lot, we're going to give you the opportunity now just to type those questions out in the chat. Marla, if you don't mind moderating questions that you might have regarding the competency framework. I know some of the questions we've had in the past are, we noticed that these are a lot of Canadian resources, and we just kind of want to, our response to that is that we've got a lot of resources on there, not just Canadian resources, a lot of the evidence that informs the competency framework or international resources as well.
Doesn't look like we have anything currently. I do encourage everyone, if you have any, please type them in now.
Even if it's something like I'm on the website and I'm already lost, kind of thing of just navigating anything, we're happy to help make that warm handoff kind of thing.
All right, well, nothing is coming in the chat. So if we would like to continue, and then
Sure.
folks can continue to get those questions in.
Okay, that's okay. Let's keep going. So before I hand it off to Heather, as I mentioned before, what we noticed in the resource library is that there is a lack of existing information out there that really targets concurrent disorders. Karthik, can you go to the next slide, please? So existing resources are really siloed, or they're integrated in name only. They talk about both, but they really don't talk about the specifics or interactions or practical care recommendations of concurrent disorders. I won't criticize about all information available out there, but we really didn't see information that was represented or reflected the literature review that we did that led the development of our competency framework. And some of the resources that exist out there live behind paywalls, but nothing is actually free. So we really wanted to target that. So our aim was really to offer evidence-based resources in concurrent mental health and substance use for a diverse audience. We really wanted to make information that really targeted our competencies as well. So in addition to the funding we received for the competency framework, we also requested funding to create an online concurrent disorders curriculum. So the aim of this curriculum was to foster knowledge and skill development among learners to support individuals with complex concurrent disorders. We used a really strategic method of developing this curriculum. So we wanted to make sure that not only was it guided by, you can go to the next slide, Karthik. We wanted to make sure that the development of the curriculum and the framework wasn't just done by clinicians. So we really wanted to strategically address this. So in addition to having our clinical experts in strategic development, strategic planning of the framework and the curriculum, we also included individuals with lived and living experience with concurrent disorders, family members of individuals with concurrent disorders, as well as First Nations representatives as well, who had Indigenous expertise to help guide the development of the curriculum. In addition to that, we had a senior project management team to support us. As well, we had a core content team, and that core content team had the same demographic representation as our project management team, our strategic planning team, which included clinicians, individuals with lived and living experience, family members, as well as First Nations knowledge experts as well. So we really, really wanted to ensure that we had not only clinical experts, but the end beneficiaries to guide the development of the concurrent disorders curriculum itself. So I'm going to hand off to Heather now, who's going to go through a little bit more about the curriculum itself, and then Karthik's going to go into a demo of the curriculum. Heather?
Sure. And just one other thing to mention is we also, it's on the slide as well, that we worked with e-learning developers as well as experts on how can we make this curriculum really interactive and use best adult learning principles too. All right, so on our next slide, oh yes, so again, as we said, when we were developing this, we want to address the gap in concurrent disorder learning that we were noticing. And we thought, okay, let's first address those foundational introductory level competencies. And we also, when developing this content, said we want to make sure it's applicable regardless of your setting. If you're a family physician, you're a shelter worker, you're a nurse, social worker, receptionist, you're in the correctional system, that these courses are targeted to anyone who's looking to increase their competency at the foundational level, that these would have something applicable as well as really practical for you too. So next slide. So here is our 3 introductory courses that we created. This is the first one. Each course is about 2 hours in duration to complete each one. The learning objectives of each course were based on that competency framework and examining those foundational levels. So you might notice in looking at these learning objectives, you might notice some similarities to that self-assessment that Rick was just guiding us through on the competency framework. You might notice, oh, that has a lot of similarities here, right? If you didn't have those competency levels, this is here how you can level up. So this first course we developed was about understanding concurrent disorders. So getting all learners on the same page on the language we use to talk about concurrent mental health and substance use health. What's the role of language and stigma? How it can influence our judgments? What's the bi-directional nature of concurrent disorders? And so what I want to do now is I'm going to pass it over to Karthik. So he is going to show us where do we find this curriculum within that Center for Learning website. And he's also going to demonstrate it. So you have a sense of what is some of this content, what's the interactive nature, just to kind of give you a taster. Obviously, we're not going to go through the whole 2-hour course, but hey, what do some of these even look like?
Dr. Fulton. Is everybody able to see my screen?
We were, but it just went away. Oh, okay, it's back.
Great. So for people that would like to take the long route, a stroll on the park, there's 2 ways to get into this course. For somebody like me, such as where I'd like to learn more, I'd like to learn the background of how this was created and get the extra bits of information, you could land on our landing page here, and you could stroll your way through, which gives you like a little bit of the background information that Dr. Fulton was just mentioning about on how this was created and why this was put in place. You can, once you're logged in after signing up, like how Rick had demonstrated, you could access the course from right here. But the other way to get there is also to click on the dashboard right next to your profile picture, where you could see the entire courses in collection, and this is the course that we'd be talking about today. So this is a course that we've been working on for the past year, and this gets me excited even now. I'd like to walk you through some of the key features of this course. So we took an innovative approach to condense a lot of information, and we wanted to make sure that the course is as interactive as possible. The first step that we ensured was enacted was to make this into a gamified approach, thereby listing out badges at the end of the completion of the course. And knowing that it is challenging to provide education in 2023, where everybody's attention span is shortened because of the influx of social media and so on, we didn't ensure that the person that's going through the adventure chooses their own pace. So we made sure that we built this course in a micro-learning format, which is modular, and it caters to the needs of, like, for example, each snippet of a module is like 3 minutes in duration, and which gives a sense of accomplishment of completing a set of things. I'm just going to get started with you to just give you a glimpse of what the course looks like.
Mental health and substance use challenges are prevalent in our society. People working in almost every setting will encounter situations related to these issues. People with mental health and substance use concerns are our sisters, brothers, parents, children, family, friends, ourselves. You're likely here because you want to change the narrative. You're hoping to be the change you wish to see in the world. It can feel overwhelming at times to understand these issues, to know where to start or how to help. These introductory modules are designed to provide foundational information about concurrent disorders to help you better serve those you work with in your unique role and setting. These learnings are relevant for a range of service providers across several disciplines and will apply whether you are a nurse, housing worker, peer support worker, family physician, trainee, or some other kind of professional helper. There will be relevant knowledge and skills, no matter your setting. Whether that is a rural or urban environment, a shelter or complex care, an emergency department in a hospital or community health, corrections, or another setting not mentioned. We recognize that learners come with different educational backgrounds and life experiences. Some of you might have decades of experience with your own, or a loved one's mental health and substance use concerns. For others, much of this information might be new and really challenge what society or others have taught you about mental health and substance use. This curriculum aims to deliver the most up-to-date evidence from research, combined with clinical expertise from helping professionals, as well as the lived and living experience of people with mental health and substance use concerns and their families. Multiple perspectives were included to ensure that the content is evidence-based, helpful, and reflective of the realities of people's lived experiences. Together, we are changing the landscape of care and services for people with concurrent disorders. There are infinite ways to help people. We hope that this curriculum will enable you to do your best work and spark even more ideas on how to improve care in the future for people with concurrent disorders.
All right, before I go any further, I'd like to quickly pause to have Dr. Fulton have any of her remarks or reflections.
Nope, that's just sort of the first orientation video to just let people know what's the frame that we're kind of coming at these challenges with, what we're hoping people will achieve with this course. And so that's just our first introductory video, and Karthik will be showing a couple others as well.
Thank you. Going into the actual course itself, I just wanted to mention briefly that, just like Rick had mentioned earlier before, even though it is Canada focused, the resources that were behind this was like a thorough evidence-based systemic way of internationally recorded evidence, including the United States. So I just wanted to take a brief moment to highlight that. Getting back into the course itself, so we made sure that the whole course was an interactive platform. So we opted for something like a storyline format with the help of the eLearn developers.
Did you know there is no official definition of a concurrent disorder? In fact, terminology differs by country and region. In this training program, we define concurrent disorders as meeting the diagnostic criteria for at least one substance use disorder, SUD, and at least one other mental health diagnosis, for example, schizophrenia, major depression. Having two substance use disorders, for example, alcohol use disorder and opioid use disorder, or two mental health diagnoses, for example, major depression and generalized anxiety disorder, would not mean someone has a concurrent disorder. This definition is consistent with how other Canadian organizations define concurrent disorders.
One of our other main objectives when designing this course was to ensure that this was interactive and also taking into account and being cognizant that this addresses like a foundational level of broad audience group. We wanted to make sure that it was as interactive as possible and there was very little information at any given point on the screen. We have, if you notice, there are 4 buttons on the top. We made sure that accessibility features were built right into it. The first button opens up like explanation for the things that are occurring on the screen at that moment, and you have like a volume button here. If you need any help as to navigating the buttons on screen, you have a help button right there. And one of my favorite features is an expanding glossary, as in when there's new terms that come across that are present in the course, you'd be able to find them right here. One of my personal favorite features of this course is what I'm about to feature right now. Most of the courses that I've come across have been primarily didactic heavy and speaks to the theory behind most practices, which is why what I'm about to show excites me.
When talking to people about mental health and substance use, whether that's speaking with a person accessing the service where I work, a family member, one of my colleagues, or writing a note or letter of some kind, I find it's essential to clarify terms. I'm always thinking, does that other person have the same definition of a word that I do?
Again, for accessibility reasons, we also ensured that there's a readable component attached to each audio that plays. Limitation of time.
Can I just add something? Thank you so much. So one of the things that we really want to focus on in the development of this curriculum, as Karthik was speaking to, was making sure that we had a lot of different ways in presenting information. So as you can see, we had an audio clip of an individual, we had a transcribed a bit of information. We've got, in order to really support people in foundational understanding of concurrent disorders, there's a lot of information. There's so much information out there, but we didn't want to sacrifice anything. So we've done some unique things of condensing a lot of the information into some unique ways. That real life learning that you listened to was an example of a collected list of clinical pearls. So what we did was we interviewed practitioners around the unique ways they deliver concurrent disorders care, and we represented those in these like little real life learnings that offer a collection of those clinical pearls. The curriculum itself also has interactive case studies as well. And again, we really want to make sure we didn't sacrifice any of the information that we were bringing to the curriculum. At the same time, we didn't want people sitting here forever. So we wanted to make sure that it was engaging as well. So we've done some really creative ways of condensing that information as well into some really cool activities. Thank you, Karthik.
Thank you for adding that, Rick. Also, just to mention, like the whole system keeps track of your completion. So there's a progress bar up at the top, and based on your convenience, you can take this journey at your own pace. If you notice, some of the tiles are grayed out, and this is based on dependency. We were also able to like incorporate knowledge testing questions at the end. That way you're able to self-assess and self-check on the learning objectives being accomplished.
One thing I want to also add is that, as you notice, these are tile formats, and I mentioned tile formats earlier before, is all of the resources on the website are depicted in this tile format. That way we're able to display complex information from any source point on the internet directly on our Center for Learning and engage in the same functionality that exists within the platform. For example, adding any of these tiles to your plan. So if there's a specific tile that you want to add to your plan, or adding specific tiles to your favorite list as well. Sorry, I just want to add that piece. Thanks, Karthik.
No problem. Knowing we're short on time, I can do another quick module just to highlight some of the key features that I enjoy in this course.
Did you know that how you talk about an issue frames how someone will interpret it? Read and imagine the following scenarios. The car raced through the intersection without stopping. The car proceeded through the intersection without stopping. What kind of mental image did you have for each? Likely, you imagined the car going faster in the first sentence. Both sentences described the same event, yet we understood the event differently because of the descriptive words used and the images and associations tied to those words. Our brains make similar associations and images when we communicate to help us better understand and interpret the message. This is why the words and terms we use really matter.
Like Rick was mentioning earlier, we wanted to make sure that all the complex information was displayed. So we took this challenge up with an innovative solution by making sure that the information was cascading. This enabled us to present a lot of information without compromising on the academic density that's behind it. This course is available free of access for everybody whoever signs up for this from the dashboards. Thanks. Passing it back to Dr. Fulton.
Great. Thank you so much, Karthik. So again, to summarize, we've got interactive content. We've tried to make sure that that content is accessible to different forms of learners. Also, depending on your role and site, I've got 15 minutes over lunch break to work on something. Okay, you can complete a tile versus 2 hours might be totally overwhelming. If there's a tile you really like, you can favorite it or add it to your learning plan. We have a lot of different features here. And again, trying to keep it practical. So anything that we thought was really important, but maybe a little bit theoretical, we added then a real life learning. So a real clinician or practitioner, how do you apply that in your life? What does that actually look like? If I'm going to use destigmatizing terms, what does that look like in my day-to-day? So that when someone leaves this learning, hey, they did a 15-minute tile there, what is going to be different when I go onto the floor, when I interact with someone? How am I going to be different? How am I going to act differently now based on that? And giving some real concrete examples. We didn't want this to just be sort of theoretical stuff. We wanted this to be real and practical and really reflect the realities of where we all work with people who are experiencing mental health and substance use health difficulties. So Karthik, could you get the slide up with the second course that's coming up? So the first course is already live. People can complete that. We are very excited. We have 2 more courses. So that's just the first of 3 courses that we have upcoming. So the second module is on the development of concurrent disorders, including the role of social determinants of health. So again, if you remember back to those competencies in the framework that Rick was completing with us earlier, you might see, oh, hey, they're reflected in some of these learning objectives here. In this second course, we discuss the role of trauma and the development and maintenance of both mental and substance use health conditions, and special attention is paid to racism and its impact on care. One thing we really heard from learners in general was the importance to keep things, again, practical, relevant to their daily lives as professional helpers. So we have 2 cases where people can apply the content they just learned to understand more real life scenarios, and options for how they practice and how they can act might now be different, potentially, some ideas. And so again, we want people to be leaving this with not only newfound knowledge, but again, that practical empowerment to do things differently. And so this course will be launched very shortly in the fall of 2023. And our next course is going to be launched as well. This is our third one. And the third course is really about exploring recovery. What does that mean in terms of both mental health and substance use health? We review factors from across the literature, across different countries on just substance use and mental health, what can promote recovery, what can we do to encourage people to reflect on their own roles as helpers, and how potentially could you be both a facilitator and sometimes unintentionally maybe hindrances on someone's recovery journey. And so the focus is, again, providing high quality information based on the latest evidence, but also presenting this information in engaging ways that are interactive, that make people really reflect on their roles and their practice and how what they are learning directly applies to what they're going to do in their job and their role this afternoon or tomorrow after working on this resource. As part of this course, in the third one, there's also additional self-reflection and resilience exercises regarding burnout and compassion fatigue. So this one is in production at the moment and will be formally launched in the winter of 2023. And we're just so excited about them. And we really hope that you folks are going to be excited about these free courses as well. I'm going to pass it back to Rick now.
Thanks so much, Heather. Terrific for doing that. And thank you everyone for joining us. I really, really hope that you folks gain some wisdom from our Center for Learning. So again, our Center for Learning is a free online resource hub for people who support individuals with mental health and substance use concerns. It's really great because you can go there, assess your competencies for working with people with mental health and substance use needs. And this is a groundbreaking thing because it allows us to really take a snapshot of where we are or take a snapshot of where we'd like to be in our career. Those same competencies were then developed into a concurrent disorders curriculum, which we've launched the first of the 3 foundational level courses. We're going to be adding the following 2 foundational level courses this winter and fall. And we're going to be continuing to expanding the concurrent disorders curriculum over the coming years. It's not going to stop. We're going to keep adding courses to that curriculum, and they're always going to be free because we really want people out there to access this information. And we really think that the path forward is ensuring that we are standardized in our approach when working with people with mental health and substance use needs. We can't all be doing different things. And so this is our attempt to really chip away at that siloed, non-integrated approach that traditionally many places around the world are doing, including British Columbia. You know, we're starting here and we think that folks out internationally can benefit from that as well. And we hope that people use this space and create a customized learning journey for them, and then that we can all really start to work together in a standardized way. So that's our presentation there. Thank you so much. Slides from this talk will be distributed afterwards. And again, this talk is being recorded and be available after the session today. Again, the website and our contact information is on the next slide. Great, and thank you. So we'll pause there for any questions or comments that people might have, any observations as well about the Center for Learning and any of the resources that we've spoken about today.
Thank you so much. This is such a great tool. We're getting just lots of comments saying what useful information this is and what a great tool this is. We did have one comment. This was whenever you were talking about Canadian resources versus US resources. Somebody said, I believe as long as there are evidence-based resources, there should be no issue with where it is located. We need good learning resources, which is very in line with your center. So, but no questions. If we want to, someone said this is a great informational tool that is helpful with developing my skills. Thank you. Yeah, so just a lot of thanks. So if anybody else does have questions, get those in now. I'm going to go over some housekeeping items quickly. and then I'll check the chat box again. Thank you so much to the Center for Learning for such a great webinar. We would like to remind all of our participants that today's PowerPoint, along with the recording of today's presentation, will be uploaded to the webinar library located on IREDA's website sometime within the next week. Once we have these resources posted, a link will be sent to all of today's webinar registrants. I now want to remind you of our evaluation and CEU process. You should receive several follow-up emails from us. The first email will include a link to the evaluation, and the second email will include step-by-step instructions on how to obtain CEUs. Please note again that it will take up to 48 hours for your CEUs to become available because we do have to cross-check your attendance records. We would like to specially request that you fill out our evaluation. It should take no longer than 2 minutes of your time. And again, we want to thank everyone for taking time out of your day to participate. If you have any questions at all, please email us. The email address is info@ireda.org. And before we conclude, let me just check and see if any other questions have come in. Looks like just a lot more positive comments. So with that, if there's nothing else, I will conclude the webinar. Thank you so much, everyone.
Thank you.